Welcome to Alhambra, a city located in the western San Gabriel Valley region of Los Angeles County, home to almost 80,000 diverse residents and our beloved health sciences campus. Alhambra is widely known for its vibrant food scene, particularly in its wide variety of Asian and Latin American cuisine, as well as its rich historic architecture. There is a majority Asian population in this city, and most locals speak another language other than English at home. Many avenues for community involvement in Alhambra are offered through youth after-school programs, the Sunday farmers market, the public library, and much more.
Alhambra is a pretty quiet city over here, and I usually in my leisure time I walk around the area, the city area. In that direction, a lot of place to eat, and which is very good for the aged people like me, 70 something, walk around without driving the long distance. So this is a very peaceful city over here, I can say. And I went to the church over there on the second street, that in walking distance. That church has bilingual. They have English and Mandarin. So I enjoying their the worship over there. I make friends over there as well. So I can use our native language, which is Taiwanese, talking to some of the people over there. Yeah, that's I like. Yeah.
A portion of the population lives just below the poverty line, and food insecurity remains a great concern for residents. Around 33% of residents participate in CalFresh, and the majority of public school children qualify for free or reduced lunch. Rachel Lee shared her personal experience with us.
My grandparents also live with us, and we have they have EBT, so I help them do groceries, and it's pretty reasonable with that.
The Alhambra Hospital Medical Center, along with various urgent cares, clinics, and nursing homes, encompass the means of accessing healthcare in this city. Residents seem to employ a holistic approach to health and wellness.
I would say language is a huge one, although there is a huge Asian population, and there's a lot of healthcare doctors that speak the language too. I feel like there's a huge difference because in Asian cultures there's a lot of like herbal medicines compared to Western medicine, so it just kind of depends what you want, but I think you should have access. There's access to both, like we use both, yeah.
Although Alhambra is not in a primary care shortage area, many of its adult residents are uninsured and cannot access needed healthcare due to economic status.
For this past 3 years, I've been here at the Keck Medicine of USC Specialty Pharmacy, where we service patients who are very sick. They're on complicated specialty medication regimens, mostly rheumatology, dermatology, oncology, pulmonary like cystic fibrosis and interstitial lung disease, immunology, allergy. So super specialized disease states that maybe might have limited access in smaller hospitals or hospitals that don't specialize in some of these diseases. So I always liked the aspect of patients being able to have access to a pharmacist in the community, and how important that is, and how important it is to have qualified health professionals that are available to patients in the community setting. So a patient can really walk into a community pharmacy and ask any sort of health related question, and the pharmacist can help triage the patient. So the patients that we service, I would say about 50% of them are health literate. The reason why it's higher is because they've been dealing with some of these diseases since childhood. And because of that, they've had access to the hospital system, or they've had multiple stays in the hospital. So they've learned a lot of the health literacy over time. But I would say about 50 to 60% probably still aren't, and still require a lot of feedback, guidance, and assistance from the pharmacist. I think some of the barriers are patients who are not willing to take the time to talk to us, because we spend a lot of time talking to patients, but sometimes, patients are, if they're busy or they work, a lot of these people are working, so they don't have the time during the day, and we're open 9 to 5, or 9 to 6, and they don't have the time during the day, or they're at work to be able to talk to us. We work with the street medicine population. Most of them that want to be treated, they're going to get treated because that team actually helps them get onboarded with Medi-Cal. So not having insurance isn't really a barrier in that sense. but they have to be willing to work with the team to sign on to Medi-Cal and also be seen and be found in the community so that they can be treated. So sometimes patients will accept everything and then the following month we can't find them. So that's another major barrier there. And then lastly, I would say one of the biggest barriers is patients who are kind of in the middle where they're not qualifying for Medi-Cal, they're not old enough for Medicare and they're not disabled, but they're in the middle with the commercial plans where sometimes their copays can be very high. And if they don't qualify financially for financial assistance because they do work, but they don't work enough to be able to afford the high copays. You know, they don't make enough to be able to pay $3,000 a month for their medication. Sometimes we find ourselves in a place where we can't help them and we're having to escalate to other external resources to be able to help them where it's not always guaranteed.
Overall, Alhambra offers a diverse and accessible health and wellness landscape, blending public services, private care, and community-based programs to support residents' physical, mental, and preventative health needs.
If you ask me how do I like Alhambra, I think yes, I do. The Alhambra is very convenient for me.